Okay, so we will be looking at spinal anesthesia. It is performed between L3 and L4, and we perform this anesthesia if there is need for lower abdomen surgery, pelvic surgery, perineum, or lower limb surgery. So it is performed between L3 and L4, as you can see in this picture. So we perform spinal anesthesia, epidural anesthesia at this position to prevent puncture of spinal cord, and then we insert a syringe and for a spinal anesthesia. Then we will have to insert the syringe, and we have to cover these layers of from skin to subcutaneous tissue and then ligament and flavum, and then deep down we will have to insert the syringe for spinal anesthesia. Then we have to inject the anesthetic agent. Bupivacaine is usually injected in spinal anesthesia. So uh, to anesthetize the patient, and then we have to inject the spinal anesthetic agents, and then we have to also use some aseptic measures to make sure the clean and aseptic environment, as you can see here. And spinal and epidural anesthesia, there are some contraindications of spinal anesthesia. If the patient has bleeding, death is infection, intracranial pressure raised, or intracranial hypertension, or an infection, or patient refusal, or there is any localized sepsis, allergic drug, patient's inability to maintain the still position, and previous spine surgeries. These are contraindications. In these conditions, there should be no spinal anesthesia performed, or any neurological disorders like myelopathy, spina bifida, arachidonitis, or aortic stenosis can result into these conditions. And other contraindications are hemorrhage, back problem, muscle strain, arthritis, respiratory disease, septicemia, or any hypotension. We do not have to perform spinal anesthesia. So, as I already mentioned, the drugs are used as bupivacaine, tetracaine, lidocaine. So, there are different factors that determine the level of anesthesia, like volume, concentration, barbotage, speed of injection, patient's position. Spinal anesthesia usually performed in sitting position, specific gravity, site of injection, and height of the patient, with abdominal pressures as well. So in this way we perform spinal anesthesia, and